Hi, my name is Dr. Akiba Green. I'm with Lake Norman Health and Wellness, and we're here talking about your brain. More importantly, we're here talking about why isn't my brain working. I have a revolutionary understanding of brain decline and effective strategies to recover your brain health that we're going to talk about today. What's going to be covered? How your brain works, the underlying causes of brain decline, and what can be done to maximize your brain's health through integrated medicine and functional neurology. There's a book that one of my colleagues and mentors wrote, Why Isn't My Brain Working? By Dr. Datis Karazian. I highly recommend you purchase or pick up either on Kindle or from our office directly or Amazon or anywhere else, because it's a great book that's going to talk about and give you more information on a lot of the topics I'm going to cover today. All right, when we talk about brain problems, we have to address one thing right up front. There's a difference between a hard brain lesion and a soft brain lesion. A hard lesion is something you're going to find on positive imaging. An MRI or CT is going to show something. There are obvious exam findings. Medical neurologists diagnose these, and they are usually tumor or pathology based. What we are talking about is called a soft brain lesion. Now, soft lesions have no positive images. You're not going to find it on an MRI. Often the exam findings are very subtle. But there are functional problems, and you need a functional neurologist to treat that. When you go to the neurologist and you have neurological symptoms and the doctor says there's nothing wrong with you, that's a soft lesion we're looking at, and he doesn't know how to assess for it. Symptoms of functional soft brain lesions are varied, but you see depression, anxiety, insomnia, fatigue, memory loss, brain fog, chronic pain or headaches, attention deficits. You can't focus properly. You're not enjoying life. You're not social, or you're too emotional or impulsive. How about you get vertigo or blurred vision, or you have problems with balance and spatial orientation? Weakness or numbness or tingling in your extremities. Spontaneous movement disorders, tics. You can't follow directions very well. You have digestive problems or high blood pressure. You have OCD symptoms. You have mood swings or lack of motivation. Well, that's a lot of symptoms. How prevalent are these problems? 1/8 of seniors, 1 in 8 seniors develop Alzheimer's. 1 in 8 children develop spectrum disorders. Dementia affects 24 million in the world right now. It's expected to double by 2040. Use of antidepressants and anti-anxiety meds has never been higher. You know what the #1 cause of accidental death in the elderly is? Balance disorders, falling. So what does a healthy brain need to avoid these problems? You need proper energy, glucose supply. You need proper oxygen. You need proper neurotransmitters. You need proper activation. And you need an inflammation-free environment. If you don't have these basics, medications won't work long-term, which is why so many people go on in neurological medication short-term, see results, but they keep changing the doses. You may have experienced that yourself. So what is metabolism? At its basic level, you eat food and it turns into energy for your body to use. It's a metabolic problem, and there's decreased energy production because of it. Now, which organ consumes the most energy by far? The brain. Up to 30% of our daily glucose and oxygen goes right to the brain. There's different areas of the brain that are responsible for different functions. The frontal lobe is the largest lobe, so it needs lots of energy. It's right up here. Defines our personality. It's executive decisions, social behavior, impulse control, allows for focus. It governs our planning and motivation. Voluntary muscle movements, gross and fine motor. When you move, this is what's controlling it. If you have depression, this is a frontal lobe fatigue problem. Now, symptoms of frontal lobe degeneration: depression, slow movement, mental sluggishness or laziness, poor impulse control, poor focus, poor social behaviors, poor handwriting, poor motor planning, poor cognitive learning, math or language. How about the temporal lobe? This is responsible for hearing, speech, memory, emotional response, smell, interpreting sounds. If you have tinnitus, ringing in the ears, you can't hear due to background noise, you may have a temporal lobe problem. The hippocampus is another area that we're going to talk about. It's responsible for language, memory, hormone production, sense of direction, your sleep-awake cycle, and actually Alzheimer's is a degeneration of the hippocampus. Symptoms of temporal lobe degeneration: memory loss, hearing difficulties, tinnitus, that's ringing in the ears, insomnia, abnormal shifts of fatigue during the day, and dementia. How about the parietal lobe? It processes all touch sensations, hot, cold, pain, etc. It interprets those sensations. Texture, weight, size, shape of something you touch. It interprets input from skin, muscles, joints, vision, so that the body knows where it is in its environment. There's something called the homunculus. The homunculus brain is that part of the brain that associates with every aspect of our body. So touch. And certain parts of our brain are bigger and more associated than others. Like our hands and face have more sensation than anywhere else. It's the largest part of the homunculus. If you've never seen this picture, it's actually a pretty interesting picture. And there's different versions of this. But this is important because there's sensory aspects and motor aspects that we have to deal with. Alright, symptoms of parietal lobe degeneration. You're unstable in the dark or on an unsteady surface. You misjudge where your body is. You're very injury prone. You can't recognize objects that you touch. You get lost easily. You have numbness, tingling, or pain in odd parts of the body or all on the same side of the body. The occipital lobe is responsible for processing visual information. Degeneration of the occipital lobe leads to difficulty in processing visual information like shapes, colors, or movements. Hallucinations, floaters in your eyes, visual floaters, visual persistence or reoccurrence after the image is gone. How about the cerebellum? This is the hindbrain, it's the little brain. It calibrates muscle coordination. It calibrates input from the inner ear to balance and eye movements. It calibrates information from your muscles and joints and filters it before sending it to the brain. Symptoms of cerebellar dysfunction include dizziness, vertigo, blurred vision, nausea from visual inputs, poor balance or clumsiness, subtle shake at the end of movement, so an end stage tremor. You're moving and then at the end you move. If you're coming in, there's a little movement as you're coming in to do something. Neck or back problems also. Now in the brainstem, we have our autonomic nervous system. It controls things automatically. Think about your organs, your heart, your lungs, your stomach, your blood vessels, your glands. And we have two halves of the autonomic nervous system. The parasympathetics, which is like rest and digestion in its lower brainstem, and the sympathetics, which is your fight or flight response, upper brainstem. They cannot simultaneously work at the same time. When one fires, the other calms down. Guess which system fires when we're stressed? Yeah, the sympathetics. It's our fight or flight response. And stress isn't just emotional stress, but also metabolic and chemical stress. 90% of the neocortex's job is to stimulate the lower brainstem's parasympathetic activity. When we have degeneration of the neocortex, we lose parasympathetic activity and the fight or flight nervous system takes over. Symptoms of high sympathetic activity, a lot of the symptoms that people deal with include high blood pressure, dry eyes, dry mouth, loss of taste or smell, poor digestion or constipation, headaches, chronic pain, insomnia, fatigue, hormone imbalances, sensitivity to light and sound, cold hands or feet, frequent urination or incontinence, erectile dysfunction, or low libido. Now, what causes the brain to degenerate? I've got these 11 things we're going to talk about. Blood sugar imbalances, stress, poor circulation and oxygen, food sensitivities, poor gut function, inflammation, poor neurotransmitters, hormone imbalances, poor essential fatty acids, toxins, and lack of activity. So remember, you can't separate the health of the body from the health of the brain. So blood sugar imbalances include insulin resistance or diabetes, which would be blood sugar above 99, so 100 or higher. And 100 to 126 is insulin resistance, 127 is diabetes. Or hypoglycemia, which would be blood sugar below 80. When you have high blood sugar, it leads to high insulin, which is inflammatory, which leads to excess tryptophan or tyrosine into the brain, which leads to excess serotonin and dopamine, which leads to an increased tolerance of serotonin and dopamine, which leads to a decrease of symptoms. You end up getting an increase of symptoms. You get depression, you get lack of pleasure, you get all these things break down as a result of it. Now what's interesting is the symptoms are the same if you have chronically high hormones of neurotransmitters or chronically low hormones of neurotransmitters. In fact, if you have low blood sugar, you get low insulin, you get low tryptophan or tyrosine in the brain, so you get low serotonin and dopamine, and you get fatigue, depression, lack of pleasure, and reward. High blood sugar, high serotonin, fatigue, depression, lack of pleasure or reward. So blood sugar is huge importance for us to correct. Now stress is in the brain, atrophies the brain, promotes brain inflammation, and it breaks down the blood-brain barrier. The biggest stress is actually not emotional. Poor diet, high carbs, fat, alcohol, smoking, caffeine, food sensitivities, anemias, gut infections, autoimmune disorders, musculoskeletal pain, but poor digestion and low GABA production as a result. There's a hormone that we have in our body called cortisol. It is our stress hormone.
And degeneration of the hippocampus in the brain leads to problems with cortisol, and you get memory loss and dementia. It shuts down the pituitary gland, so you get poor thyroid function and weight gain. Brain circulation and oxygen. Now the brain consumes 30% of your fuel. We talked about that earlier. 30% of your oxygen intake goes to the brain. The neurons can't produce enough energy if they don't have enough oxygen. The brain is deprived of oxygen for more than 5 minutes, permanent damage will occur. It's called hypoxia. Symptoms of poor blood flow to the brain include low brain endurance, poor focus, concentration. You must exercise, drink coffee to improve brain function. Cold hands and feet, poor nail health or fungal growth on toes. You must wear socks at night. White nail beds instead of pink nail beds. Cold tip of nose. So what causes poor circulation to the brain? Stress, shallow breathing, the fight or flight response. Blood is shunted to the limbs, heart and lungs. Limbs, heart and lungs. Anemias, smoking, lower high blood pressure, poor lung function, poor cardiovascular function, and diabetes. There are things that you can take to increase the blood flow to the brain. They are called botanicals. They are herbs. Feverfew extract, ginkgo biloba, huperzine, and vinpocetine. Also, exercise with oxygen therapy is a great tool to use to increase blood flow to the brain. How about food sensitivities? So, if you eat food, like genetically modified foods, it's going to cause your immune system to mistakenly attack it. When that happens, cytokines are released into the bloodstream. These are inflammatory cells, and they cross the blood-brain barrier, and they're going to react with the brain's immune system. This is going to cause inflammation of the brain. The most common food sensitivities are gluten, dairy, and soy. You have to get tested, and you have to get tested accurately. There are too many tests out there that get false negative responses. Poor gut function in your brain. Poor gut function equals poor brain function. Poor brain function equals poor gut function. This is huge. What causes poor gut function? Diet, stress, cortisol issues, food sensitivities, leaky gut syndrome, dysbiosis, gut infections. How do you know if you have these problems? You must get tested. Brain inflammation can lead to problems in the body. Body or gut inflammation can lead to brain inflammation. So it's this vicious cycle. What causes brain inflammation? Diabetes, high carbohydrate diets, poor circulation, food sensitivities, gut inflammation, leaky gut syndrome, which leads to a leaky blood-brain barrier issue. And there's a way for us to test in our office using GABA to see how you do with that. High cortisol, high homocysteine levels. How about alcohol? You need proper neurotransmitters in order to function properly. What happens is you've got this neuron that releases neurotransmitters to the next neuron. And desensitization of these receptor sites, so the receptors stop using the neurons, well, the drug doesn't work anymore when that happens, and therefore you got to change your doses. If you're on SSRIs, antidepressants, or other neurological medications, and your doses keep having to be changed and you don't feel as good as you did when you first took it, you have this desensitization going on. Now, different neurotransmitters do different jobs. Acetylcholine deals with memory, comprehension, and math. Serotonin deals with enjoyment, satisfaction, and sleep. Dopamine is motivation, social problems, or self-worth. GABA is calming or anti-anxiety worry. So proper balance is key. Now, what can cause a neurotransmitter imbalance? Medications, SSRIs, DSRIs, or like benzodiazepines. Proper gut flora or function. How about vitamin deficiencies like B6, B12, magnesium, or iron? Anemia, liver issues, MSG or aspartame or other excitotoxins. Food sensitivities, autoimmunity, hormone imbalances, leaky blood-brain barrier, amino acid or EFA deficiencies, and inflammation. Hormone imbalances are another big issue. Estrogen impacts serotonin receptors in men and women. Estrogen also impacts dopamine and acetylcholine receptors in women. Progesterone impacts the GABA receptors in men and women. Testosterone impacts dopamine and acetylcholine receptors in men. And thyroid hormones impact all neurotransmitter receptors in both sexes. All hormones production depends on adequate fuel. You know what kind of fuel you need? You need cholesterol. You didn't realize this. What does cholesterol do in the body? I asked that question to 10 people, and 9 of them are going to look back at me like I'm crazy, and one's going to say, isn't it bad for you? Cholesterol is vital for your body. It makes your hormones. You can't make hormones without it. So you need proper essential fatty acids. 60% of your brain is fat. Vegetable oils and hydrogenated oils make membranes of nerve cells rigid and unresponsive. They're bad for you.
So you need proper omega-3 oils, and you need a ratio of omega-3 to omega-6 to avoid inflammation. Avoid sunflower oil, cottonseed oil, soybean oil, sesame oil, and canola oils. You need at least 5,000 milligrams of EFAs daily from diet and supplements. Toxins in your brain. So toxins lead to brain degeneration. If I ask you a question, are there more toxins in our environment, in our food or water supply versus years ago? Of course there are. Are we taking more prescription or non-prescription drugs today than we did 50 years ago? The answer is yes. Are we getting more vaccines? The answer is yes. Only a small minority of sympathetic compounds that are introduced to our environment have been researched adequately for safety. I do a lot of work on genetically modified issues, GMOs, fighting them, because these are things that just are not properly tested. What do our bodies need to handle these toxins? A proper functioning immune system, proper functioning liver, and proper testing and functional medicine. 2/3 of the toxins can be avoided just by eating organically grown foods. Believe it or not. Proper brain activation is important. Every sensory input activates the brain in some unique and specific way. Your brain and body is just a huge receptor. Your eyes, your ears, your taste, smell, skin, joints, muscles with gravity. So what are the two biggest brain inputs? Gravity, so exercise, and touch. Activate receptors to activate your brain. Now there are brain-based therapies in conventional medicine, counseling, exercise, music, hobbies, sleep. There are brain-based therapies in advanced or functional neurology, eye movements, modulating excessive stimulation to light and sound, eye lights therapy, whole body vibration, non-linear complex movements, gaze stabilization, balance exercises, timing and rhythm exercises, deep breathing exercises, unilateral stimulation, spinal manipulation, yoga, neural feedback, massage, many more. So what does a healthy brain need to thrive? Proper blood supply, proper glucose supply with energy, proper oxygen supply, proper neurotransmitters, proper activation, and an inflammation-free environment. If you don't have these basics, medications aren't going to work long term. We talked about that earlier. So what's next? Make your appointment at the front desk. You're going to come in, you're going to see me for 2 visits. Visit 1 is a complete neurological evaluation. Review of existing labs that you've had done. Bring them in. Let me see them. You're going to fill out paperwork for me and bring it in to me. And get a copy of Dr. Karazian's book. I want your spouse or significant other here for both visits because we're doing a lot of exams on you. Visit 2, we're going to sit down. It's a case review. If I accept your case, we're going to talk about what testing you need to be done. We're going to review the neurological findings from visit 1. An overview of my treatment recommendations to you. Review of your financial obligations. And you also must be with your spouse or significant other for visit 2. What else do you need for your first appointment? Bring shorts and a t-shirt. I got to get 2 inches above your elbow, 2 inches above your knees to do my exam. All paperwork has to be filled out 2 visits prior to your appointment. Get the paperwork into me so I can review it, so when I sit down with you, I'm spending the time to help you. And I would like you to bring your spouse or significant other. I only accept 5 new brain recovery patients every month. The first 2 visits normally cost $450. You're getting close to 2 hours of my one-on-one time. You make an appointment after attending this presentation, after watching this workshop, I offer you these same first 2 visits for a reduced reservation fee of $99. You get the exact same 2 visits for $99. But I have 3 rules if I'm going to accept your case. Number 1, I'm going to make sure, I should say 4 rules, I'm going to make sure that I can help you. That's the most important thing. But if I can help you, you have to be willing to make serious lifestyle changes. You have to take accountability for your health. Nobody else is going to. Insurance and Medicare only pays a small portion of this type of care. We have made our care plans affordable so that 96% of the people who see us in our office get the care that they need for as little as $150 to $350 per month through financing. You have to be willing to reach into your pocket if you're going to get yourself better. But I promise you, if I can help you, I will tell you what our steps are, I will tell you what criteria we have in place to make sure that we are improving your health, and you will get the results that I'm looking for. On a scale of 1 to 10, how serious is your illness? How has it affected your relationships, your work, your ability to enjoy your life? On a scale of 1 to 10, how serious are you about eliminating your illness? Due to time constraints, I can only accept those who are truly committed. I thank you for listening to this workshop. I thank you for your time. Feel free to send questions to me. akibagreen@gmail.com is my email. I look forward to helping you.